The doctors at Invisivein use laser treatment to target painful and unsightly varicose veins without lengthy recovery or even significant pain. And Dr. Joseph Mullaney from Invisivein is here to tell me more about the process and also to talk about the free consultations that you guys have going on right now. Dr. Mullaney, thank you for joining us.
Thank you.
Now let's talk about what is varicose vein.
Varicose veins are unsightly bulging veins under the surface of the skin, and they're the result of blood flowing in the wrong direction. Blood should be flowing up your leg, and if it's flowing down your leg, the increased flow and pressure causes the surface veins to dilate. They can be painful. They can cause aching, throbbing, tiredness, and fatigue, and they do progress over time. So the sooner they're treated, the better.
Now, speaking of treatment, one procedure that you have is pretty safe and it's pretty popular right now. You use some type of laser treatment. Describe that for us.
We use an endovenous laser. Through one puncture site, we can treat the entire course of the refluxing vein, and that's an alternative to the traditional surgical stripping where multiple incisions were made under general anesthesia. The procedures are performed on an outpatient basis in our office, and they usually take 1 to 2 hours. Patients walk in and walk out.
Oh, wow. That is, I think, pretty good based on maybe past procedures where it took a little bit longer and a little bit more downtown.
Prolonged hospitalizations and increased infections and complications.
Of course. Now, why should patients treat varicose veins right now? When should they notice that there is a problem, and how early should they treat them?
Well, generally, patients notice that they're having problems because over the course of the day, as they're sitting or standing, the increased pressure causes the symptoms to occur, and they feel better in the morning. And so if they're feeling aching, pain, throbbing, tiredness, fatigue in their legs in the evening, then that's an indication they may have varicose veins, even if they don't have the bulging surface veins. And that's the time to get evaluated. The sooner you get treated, the better, and it is just a quick outpatient procedure.
Absolutely. Now, are people more prone to it than others, or are any factors?
There's a hereditary component to it, so if a mother or father has it or a grandmother has it, there's a likelihood that the children will have it. And it's more prominent in women. Usually it becomes more progressive after pregnancies because of increased pressure on pelvic veins.
Oh, okay. Now, is varicose vein treatment covered by insurance? Because I'm sure people are, concerned about what's covered and what's not, and some might not seek treatment if it's not covered.
Most insurance plans cover the Invisivein therapy, but most of them have a requirement of conservative management, usually is about 3 months. So the sooner that you get evaluated and start that conservative management piece will make you eligible to get treated.
Okay, now you guys are really offering something special for potential patients this month and even for the month of November. Tell us more about that.
Yes, we're very excited to be able to offer free consultations and second opinions for anybody who has concerns about varicose veins. I think it's important for them to be evaluated and determine whether they have a problem, and if so, start the conservative management piece so that we can get them treated. Certainly if anybody's considering surgical stripping, it's nice to be able to offer them the opportunity to answer their questions and to see if this would be a treatment for them.
Now here's one more question. Is there a specific age where you're seeing varicose veins occur in more people, or how early can it occur?
We see high school teenagers.
Really?
And clearly they're the ones that have the hereditary component, and then frequently we see women after their first or second pregnancy, in men it's a hereditary component, and so we see that usually in their 30s and 40s because they've been putting it off for a long time. It's more common in people who have jobs where they stand, so nurses, teachers, people who work in chefs and wait staff, anybody who's on their legs for a long period of time.
And in a situation like that with people who stand a lot for their job, are there any preventative measures that they can take, whether or not they're prone to varicose veins?
There are compression stockings that they can wear, and if they have early symptoms, wearing the compression stockings, which is part of the conservative management that the insurance companies recommend, will help to decrease the venous reflux and the varicose veins.
All right, well, Dr. Mullaney, thank you so much. Some great information.
Okay, thank you
for sharing.
Appreciate it.
Stay with us. Much more Low Country Live coming up right after this break.